Well, today, interesting development in Ireland. Today, Ireland's chief medical officer announced some good news about what they've done so far in that country, but also some very serious news about what they're going to be doing moving ahead. The chief medical officer for Ireland today put out this statement. Quote, "The first task for Ireland was to suppress the virus in the population at large. We are increasingly confident that we are achieving this. All of our efforts now need to be on extinguishing COVID-19 in our community residential settings, including nursing homes." I mentioned that Ireland has fewer than 500 deaths so far nationwide. The official death toll there as of today is 486 deaths. Which is, as I said, a tragedy for all 486 of those deaths. It is a good news statistic compared to other European countries and compared to where the United States is and is heading. But the Irish government isn't just looking at their death toll in aggregate. They are counting where people have been dying inside Ireland. And so the Irish government also knows and has announced that of the 486 deaths they've had nationwide, more than 250 of them are nursing home deaths. More than half of their national total. And so, having had pretty good success tackling big picture population-wide measures to keep the epidemic overall as small as possible, they are keeping those measures in place. The Irish Prime Minister today announcing that those measures that they've put in place to slow the spread of the virus, they will stay in place into May. But they're confident that they're having good success there. That's why they're keeping it in place, because they know that it's working. But as they are keeping that in place, they now have a new priority number one. They are now refocusing their entire national response to try to save the most lives now, by focusing on the place where the most lives are being lost now, by focusing on nursing homes. The Prime Minister announcing that the government will be providing to nursing homes additional funding, additional staffing. They're also making nursing homes priority sites for coronavirus testing. Nursing home staff and patients will have priority access to testing above other population groups. They are also, as a government, redeploying senior staff from the Irish Medical Service to improve infectious disease control measures in nursing homes nationwide. And as of yesterday, they have announced terms of a new agreement in which the government of Ireland is asking health workers who are currently working in hospitals and clinics and other places in the Irish Health Service. They're asking health professionals to please volunteer to start working in the nation's nursing homes instead. Even the privately owned ones, where regular medical staff from the National Health Service wouldn't usually work. The government will pay these health workers salaries for them to start working at nursing homes. The government has agreed to provide all the PPE, all the personal protective equipment those health workers will need to work in nursing home environments. And this new deal just announced by the Irish government is not just for doctors and nurses, although it is for them. The government is also asking for healthcare assistants and cleaning staff and even catering staff to volunteer to do the same. More than half of their deaths in their country from this epidemic are their elders in nursing homes of all kinds, including those run by private businesses and charities. But the government recognizes that that's where they're losing the most of their citizens to this virus. And so, therefore, it has become priority one for that national government to surge resources and staff and expertise into those facilities, to break existing rules about who works where, to take responsibility for paying the people who need to be in there to do it, to repurpose resources from other places, to get those places in the front of mind, to put those places in the bullseye in terms of where resources are being targeted and where the most energy is being expended to try to save the most people who are at the most risk of dying. That's what they are now doing in Ireland. We could do that. I mean, just imagine. We could do that too. And it would make just as much sense to do it here as it would there, as it would anywhere. Where are you losing the most lives, and where are you slated to lose the most lives as this thing moves forward? Focus there to save the most lives. We could do that. I don't think we're going to do it at the national level, not with this government. The Trump administration at this point is refusing to even monitor the situation in American nursing homes. let alone provide them resources to fight this thing. Hell, they're not even giving them individualized guidance on how to fight coronavirus. They're just letting nursing homes figure it out themselves. Good luck, and maybe not even that. But I know some states are starting to try to take this seriously. So maybe individual states could try that Irish model. Maybe groups of counties could try this together. Maybe small consortiums of states could get together and try this regionally, if that's easier than individual states trying to do it on their own, or individual municipalities and counties trying to do it on their own. I don't know how the economies of scale work here and whether this is easier to do on a smaller scale or a larger one. But we've got to try something, because it can't just keep going like this. Nursing homes can't be left to just do this on their own.